Ask the patient's name, date of birth, and check it on the request form. This is for the correct patient identity. Carefully check the request on computer. Decide how much blood is to be collected and arrange the appropriate containers. Label the tubes with the patient details number, name, date of birth, date and time of sampling. Check if there are any specific preconditions before sampling. For example, fasting sample, high-risk patients, etc. Wash your hands and make sure that your fingernails are clean. Wear gloves if you wish to do so. See note below concerning safety. Prepare the needle and syringe or the evacuated system. Attach the needle to the barrel of the syringe or to the vacutainer, but do not remove the guard. Inform the patient about the procedure. Ask the patient to sit or lie down comfortably. Make sure that legs or ankles are not crossing. Examine both arms and select the most suitable vein. Crossing. Apply the tourniquet 6 cm above the bend of the elbow. This has the effect of partially occluding the venous return from the arm. Make sure that the tourniquet is tight enough to distend the vein, but does not interfere with arterial circulation. Once the blood is flowing well, you may wish to loosen the tourniquet to avoid hemoconcentration. Encourage the patient to make a fist, if possible. This will help you to identify the veins and aid in the rapid removal of blood. Locate a suitable vein by palpation. Do not attempt to insert the needle until you are sure of the puncture site. Clean the skin with an alcohol-based cleaner. If you touch the area after cleaning the puncture site, the area will be contaminated and must be cleaned again. Remove the needle guard and discard it. Check that the point of the needle is positioned with the beveled edge uppermost. Fix the vein in position by pulling on the tissues with the thumb, just below the intended puncture site. Insert the needle at an angle of 30 into the selected vein using a sliding rather than stabbing motion. Take care not to pass the needle through the vein. Withdraw the required amount of blood without moving the needle. Ask the patient to unclench his/her fist. Release the tourniquet. Never remove the needle before releasing the tourniquet. This will lead to bleeding into the tissues and the development of a hematoma, a swelling that contain blood. Place a gauze piece or cotton wool swab over the puncture site, but do not press down. Carefully withdraw the needle and press the swab onto the wound. Ask the patient to keep the arm extended and to take over applying pressure to the wound. Make sure the pressure is kept on the puncture site for 3 to 5 minutes to prevent the development of a hematoma. Patients taking anticoagulant medications such as warfarin will bleed for longer. Therefore, the pressure must also be maintained for a long period of time. Remove the needle from the syringe. Never dispense the blood through the needle. Discard the needle into a sharp disposal box. Never research the needle before disposal. Dispense the blood into the correct containers. Gently, but thoroughly mix the anticoagulant tubes. Check the tube label with the patient details number, name, date of birth and date of sampling. Check that the flow of blood has stopped. If not, apply further firm pressure. Ask the patient if he/she is allergic to plasters. Dress the wound with either a plaster or clean dry swab held in position with surgical adhesive tape.